Hi friends, welcome to this spotter series. Now look at this very commonly asked spotter in your exams. This is a post-contrast CT thorax at the level of the great vessels. Let us try and identify a few important structures. This is the ascending aorta, right? This is the descending aorta towards the left, right? Then this is the superior vena cava towards the right. And what is located to the left side of the ascending aorta? What is located this? What is this big vessel? This is the main pulmonary artery. You can see that the main pulmonary artery is dividing into two branches. But can you observe something lying right within the lumen of the main pulmonary artery there? What is this? This basically is something within the main pulmonary artery lumen. In both the pulmonary arteries, this is going to obstruct the blood flow, right, going towards the lungs on either sides, right? So what is this? This is a patient who presents, young patient presents, who has a history of prolonged immobilization due to a leg fracture, right? And this is going to give rise to stasis within the lower limb veins. This is a predisposition to the development of deep venous thrombosis. One such thrombus is going to get dislodged right from the lower limb veins. It is going to travel into the IVC, it is going to go into the RA, RV, and then it is going to get lodged within the pulmonary artery, and as a result of which the patient develops acute breathlessness, chest pain, hemooptysis. There is a right-sided cardiac overload that is on ECG is going to give rise to a S1, Q3, T3 pattern. So what is the diagnosis? The diagnosis is that this is nothing but the embolus which is lodged in the image, CT image you can see within the bilateral pulmonary artery. So what are we looking at? We are looking at pulmonary embolism. Right? So pulmonary artery embolism or thromboembolism is what we are discussing here. So the initial, or you can say the screening test for pulmonary embolism is D-dimer test, which is a simple blood test. This has a very high negative predictive value. If the D-dimer is negative, pulmonary embolism is less likely, but if the D-dimer is positive, then we need to further investigate the patient. Chest X-ray is not a useful investigation in most of the early cases, right, of a pulmonary embolism. Chest X-ray is normal. The investigation of choice for a diagnosis of pulmonary embolism is CT angiography, is what we are looking at here. We are able to see the main pulmonary artery well, we are able to see the embolus or thrombus lodged within the lumen of the pulmonary arteries, right? In the olden days, right, this ventilation perfusion scan was done. We'll quickly discuss a few important concepts about the ventilation perfusion scan, and if they ask you what is the gold standard test for pulmonary embolism, it is going to be invasive pulmonary angiography. Right, now let us look at a few signs. Now see, sometimes what happens is within the artery there is a thrombus which is lodged in the middle of that artery. So that thrombus does not enhance, but the arterial lumen around that particular thrombus, you know, as it gets filled up with contrast, it appears hyperdense. So this appearance is what is called as the polo mint sign of pulmonary embolism. As you can see here, this is an artery here, and inside the artery you are able to see, so inside that artery, right, you are able to see the thrombus. So this appearance is what is called as the polo mint sign or polo mint appearance in pulmonary embolism. Traditionally on X-ray, certain signs have been described, though we have discussed in most cases X-ray is normal. In subacute to chronic cases, some signs have been described. So this wedge-shaped pulmonary infarct that you see here, so this wedge-shaped pulmonary infarct, so what is this? This is nothing but an pulmonary infarct. So this is what is called as Hampton's hum. When it begins to resolve, it melts like an ice cube from the periphery to the center. So a resolving infarct gives an appearance which is called as the melting ice cube sign, right? So Hampton's hum is that infarct. When it resolves, it gives rise to a melting ice cube sign. Fleischner sign is nothing but a prominent or dilated right main pulmonary artery. Pala sign is nothing but prominent right descending pulmonary artery, right, and Shank sign is nothing but prominent right descending pulmonary artery with an abrupt cutoff with an abrupt cutoff because of the thrombus within its lumen. What is this Westermarck sign? When there is a thrombus in the artery, that part of the lung is not going to receive good blood supply, so there is going to be focal oligemia in that affected part. This is what is called as the Westermarck sign, right? So that is focal oligemia involving the affected lung field. Now, as I said, let us quickly discuss some concepts of ventilation perfusion scan. So normally the lung has, say, ventilation and perfusion which is equal, and therefore the ventilation perfusion's ratio is usually 1. Now what happens in pulmonary embolism is that the ventilation is normal, right, but the perfusion is either decreased or it is absent, right? So if the ventilation is normal and the perfusion is decreased, because the blood flow, perfusion means what? Perfusion means capillary level blood flow. So if the perfusion is decreased or absent, what is going to happen? The ventilation perfusion ratio is more than 1, or it is considered to be infinity. Now, so that is how quantitatively, right, pulmonary embolism can be diagnosed on ventilation perfusion scan. Another term which is used in ventilation perfusion scan is called as the mismatched defect. Mismatched defect. So what is mismatched defect? In an affected area of the lung, you can see ventilation is normal, but you can see that the perfusion is either decreased or it is absent. So in that part of the lung, there is a mismatch between the ventilation and the perfusion. This is called as the mismatched defect of ventilation perfusion scan, which is suggestive of pulmonary embolism, right? Well friends, we have in a very short period of time, within just a few minutes, we have revised this very high yield topic, right, of pulmonary thromboembolism. Let us hope and pray that a question is asked in your upcoming exam on this particular topic, and all of my students will be able to crack it very well. Keep trying, keep working, because bear one thing in your mind, the best for you is yet to come. It is going to happen in this exam, and when you get the results of this exam, you'll realize it. Just keep working hard till that point in time. All the best. Let's rock radiology.